We are ready to start now.
Hello, I'm Elizabeth Kwaovi. Welcome to the WHO Africa Media Briefing. First, some housekeeping. You can choose the language you would like to hear for the press conference by turning to the globe on the bottom right and selecting your language. Bonjour et bienvenue à la conférence de presse de l'OMS Afrique. Vous pouvez choisir la langue de votre choix en cliquant sur le globe qui se situe dans le coin droit de votre écran. Joining us from Brazzaville, Congo, is Dr. Matshidiso Moeti, Regional Director at the WHO Regional Office for Africa. And I will now let Dr. Moeti introduce our other panelists. Dr. Moeti, you have the floor.
Thank you. Thank you very much. So good morning, good afternoon, bonjour, and welcome to all the journalists joining this press conference, where we'll reflect on the 2-year-long path we've walked together since the first COVID-19 case was confirmed in Africa. I'm pleased to be joined for this conversation by Dr. Sandile Buthelezi, the Director General of South Africa's National Department of Health, who will share insights into his country's response and vaccination program. Dr. Albert Tuyishime, the head of disease prevention and control in Rwanda's Ministry of Health, will discuss some of the innovative strategies they leveraged to counter COVID-19, while Dr. Arlindo Nascimento de Rosario, Cabo Verde's Minister of Health and Social Security, will speak to what's needed to move past this acute phase of this pandemic. Bom dia, Honorable Minister, and a very warm welcome to all our panelists. Monday, February 14, is the second anniversary of the COVID-19 pandemic in Africa, during which countries have battled through 4 waves and several new variants of the virus. There have now been more than 11 million COVID-19 cases reported and 242,000 lives sadly lost in Africa due to the pandemic. The African continent accounts for nearly 3% of global cases and just over 4% of global deaths. However, as we stand here today, we're finally able to say that if the current trends hold, there is light at the end of the tunnel. As long as we remain vigilant and we act intensively, particularly on vaccination, the continent is on track for controlling the pandemic. It's been an extremely difficult 2 years, but against all odds, Africa is weathering this terrible storm. The continent's long history and experience with large outbreaks, along with an accumulation of learnings and expertise since the onset of COVID-19, has seen the response become more effective with each new wave. While the first wave lasted about 29 weeks, the fourth wave was over in just 6 weeks, or about 1/5 of that time. There's also been an overall decline in the average number of deaths compared to cases from 2.5 per 100 in the first wave to less than 1 per 100 in the latest one. Yet the pandemic has taken a brutal toll, with tens of thousands of lives lost and incalculable damage wrought to African economies and communities. The World Bank estimates that the pandemic has pushed up to 40 million people in Africa into poverty. Controlling this pandemic must be a priority if we are also to end the disruption and destruction and begin regaining control over our lives. Vaccination is currently our best defense. While many countries are considering booster shots, 85% of Africans have yet to receive a single shot. To reach the levels of immunity achieved in other parts of the world, vaccine uptake needs to be significantly accelerated across the region and urgently. A steady supply of doses is now reaching our shores, so the focus needs to be on translating those into actual shots in people's arms. Currently, 672 million doses have been received in Africa, but only 11% of our adult populations are fully vaccinated. African countries need to get behind the push to vaccinate 70% of their populations by mid-year if we are to restore normal socioeconomic life on the continent. And even then, COVID-19 will be with us for the long term. As we see, for example, with influenza, it's expected to ebb and flow, requiring a response that tracks conditions that will drive future peaks. That way, countries can be ready for them and minimize the impacts. Consistent implementation of a broad range of strategies is what will ultimately reduce the spread of the virus. And critical among these are community-based response interventions, including physical distancing, where possible, measures such as wearing of masks and hand washing. Other priorities include the decentralization of genomic sequencing capability and the reinforcement of clinical case management capacity at all levels of Africa's health systems. The work of, for example, the East African Community, Economic Community of West African States, the Southern African Development Community, and of course, the African Union and other partners has also illustrated the pivotal role of enhanced regional collaboration. Our estimates are that at least 15 billion has been invested in the COVID-19 response in the WHO African region since 2020 from national governments, international partners, in-kind donations, and other sectors. A total of $1.7 billion was allocated to at least 30 countries in the region by the Global Fund alone through the COVID-19 response mechanism. The World Bank, as of yesterday, has provided more than $3.3 billion in funding to 36 of our countries for emergency response efforts. On the ground, the number of intensive care beds in Africa, for example, has increased from just 8 per 1 million people 2 years ago to 20 today. WHO support to countries has included procuring 8.5 million COVID-19 tests, 433 million vaccines, of course, together with our COVAX partners, and boosting laboratory capacity to detect COVID-19 from 2 to more than 900 laboratories in the past 2 years. Going forward, when we move into the next so-called control phase of COVID-19 or living with COVID-19, the capacity of countries to reduce and control incidence of infection will be key. The ability to promptly prevent, diagnose, and treat cases is what will mitigate the long-term consequences of future infections. We also need to maintain the groundswell of political will that we're now seeing in support of local manufacturing of vaccines, therapeutics, and diagnostics. Increased access and affordability is the only solution to the vaccine inequity witnessed since the start of this pandemic. I very much look forward to our discussion today. Welcome again to my fellow panelists, and thank you for having joined us, to our journalist colleagues.
Thank you very much, Dr. Moeti. Dr. Sandile Buthelezi, let me turn to you and ask you if you could update us on how South Africa has responded to the pandemic and on South Africa's efforts towards COVID-19 vaccination targets. Dr. Buthelezi.
Thank you very much, Program Facilitator. Greetings to Dr. Moeti, the Regional Director for Africa. Your Excellency, Dr. Elindo Nascimento do Rosario, the Minister of Health and Social Security in Cape Verde, my colleague, Dr. Albert Tuishime, distinguished guests, members of the media, viewers and listeners at home, good afternoon. Let me first take this opportunity on behalf of the Minister of Health in South Africa to express our gratitude for inviting us as South Africa to be part of this media briefing, an opportune platform to share how we've actually gone through the epidemic in South Africa. As mentioned by my sister, Dr. Moeti, the journey for the past 2 years has been very difficult for humanity as a whole, but most difficult for the health sector in many respects. It has been very difficult for humanity because there's never been a pandemic like this in the almost the past 100 years. For the first time in the recent history, it has never happened that that a human being across the world would run out of ideas as we did, where to run to, as the case was in the past 2 years, and for the global community. It's also been very difficult as a country, with our first case being diagnosed on the 5th of March 2020. We went to experience the highest burden of COVID-19 in the continent. Whilst this experience was very difficult, for us, it was also a heavy blow, but there are, however, invaluable lessons that we drew and continue to draw from this painful episode in our lives. A few lessons, of course, personally for me and for the Minister of Health that we learned was one of the most important issues was the stakeholder collaboration, which was very key for us in bringing all the pillars of the society to work together, from the development partners, the multilateral partners, as Dr. Moite has mentioned, huge financial injections from the Global Fund and the other multilateral and bilateral partners. Business sector in South Africa, we know that there was a solidarity fund which was created with private partners putting in money to actually ensure that government has got enough money to fight, but also the civil society at large in responding on the ground and ensuring that we are actually dealing with this disaster in the most important way. Of course, the appreciation of the frontline staff was very central. I mean, in history, the healthcare workers became the actual pillar of the response to what was actually facing us. The need to strengthen the health system is now more than ever, especially as we battle to roll out the implementation of universal health coverage. The lessons that we've pulled together from this are actually a very good, solid foundation for us to implement universal health coverage. As you know, that for South Africa now, the act is in Parliament. We hope that in the next 3 years, it will be passed by Parliament so that we fast track the implementation of the national health insurance. I must say, however, colleagues, that we've seen the West and we actually lost a lot of lives in South Africa. And also critically, some of those lives were actually the lives of the frontline healthcare workers that were actually at the forefront of dealing with this pandemic. I'm happy that the country never ran out of beds. We're able to build on the beds that we have through our conventional health system, repurposing of general beds into COVID beds, but also putting up the field hospitals. Some of them are funded directly by the private sector so that we could ensure that we don't run out of beds. Oxygen, also, which is one of the most important and the key pillars in the clinical management of COVID. We're able to actually strengthen our oxygen provision and ensure that each and every hospital had enough oxygen and also equipment. And for the first time, we actually had the ventilators that were actually created here in South Africa. We've actually donated a number to a lot of countries, about 20,000 of these CPAP machines were actually invented through the South African vaccination program. So it's quite a lot that we've seen. However, the most critical part was a team of men and women who burned the midnight oil to ensure that we stand our ground. Whilst we have seen an increase in the burden of COVID cases, we've also been very agile in the implementation and rollout of the vaccination program, despite the strong current of the anti-vaccination campaigners who can be equated to the suicide bombers. Given our late start, which is attributable to the vaccination hoarding by the rich countries, and we thank the WHO leadership actually in ensuring that there is equity in the provision of the vaccination for the poor countries through the COVAX facilities, and also ensuring that we are able to create a good pool for all the countries in terms of the vaccine program. We know that as a country, we've currently done just less than 30 million jabs for the vaccines. And we've been really moving with the two vaccines that were available when we needed them. And we've now noticed that a number of other vaccines are being approved by our regulatory authority, which is the South African Health Products Regulatory Authority, which actually is increasing the menu in terms of the vaccines that we have in the market for the country. Of course, it's not moving as fast, and we've not been able to reach the targets that we set ourselves. We are now currently sitting at almost just above 40% of the adult population that have been fully vaccinated, of course, with the differentiation in terms of the different provinces that we're having. We are also having a robust program to actually monitor for the adverse events through the established committees, ministerial committees led by specialists that actually ensure that the adverse events are recorded and are actually dealt with appropriately through the necessary structures. We are now at the time where we're planning life beyond COVID-19 as we start the journey of in our uncharted waters from pandemic to endemic area. We have already started with the plans to reset and recover the health system, as well as the continuity for the delivery of essential health services, including HIV, TB, non-communicable diseases, mental health, and the other issues that we need to deal with in the system. It is my profound pleasure to state that we did not travel this journey alone, but of course, on our side and with us has always been the World Health Organization. And we are very grateful to your leadership, Dr. Moeti, the leadership of the DG, Dr. Tedros, for the teams that you deployed to the country to assist us, to give us the expertise and ensure that we actually are leading in terms of the response. We are very, very grateful also to the leadership of the country director, Dr. Owen Kalua, who has always been with us in our meetings through the structures and guiding us and ensure that we are able to deal with this. We are happy to also say that South Africa is actually one of the countries that has actually been identified by WHO to actually develop the mRNA hub for the local vaccine production. We are also, as you also know, that as part of the one of the Janssen vaccine, it's actually the fill and fill is being done here in Gqeberha in South Africa by one of the local companies. We believe this is to the benefit of the whole of Africa, and let's be able to respond, be able to supply ourselves, not depend on the first world countries for this. And I thank you for this. Thank you very much.
We thank you, Dr. Buthelezi. Thank you very much for this update on South Africa. Let me turn to Dr. Albert Tuyishime. Dr. Tuyishime, could you please give us updates also on Rwanda and on COVID-19 vaccines rollout in Rwanda?
Thank you very much. Good afternoon, everyone. First of all, it's a pleasure for us to join this briefing session and be able to share our experience vis-a-vis our response to COVID-19, as well as the vaccination campaign right now or ongoing countrywide. It's been now 2 years since we recorded our first case, because the first case was reported on 14th March 2020. And since then, our response has really been driven by a strong leadership and coordination from the highest level of the country leadership. We also built on in-country multi-sectoral collaboration, effective partnerships and the regional collaboration, and especially community engagement and research, data science and evidence-based decisions, as well as interventions. The Rwanda response has been based on the classic pillars, the first one being the leadership and coordinated response. Under this, that's where we have a steering committee, which is under the Prime Minister's office, and is meeting every 2 weeks to assess the situation and also advise the government to the appropriate actions. The response has also been built around the epidemiology and surveillance, infection prevention and control, case management, whereby we having the rapid response teams, quarantine, isolation facilities, as well as treatment centers across the country. And since September 2020, that's when we introduced the home-based care for asymptomatic and mild cases. But also under this pillar, that's where we have the regular update and review of the tools such as clinical guidelines and others. Under the laboratory testing, we've been working on expanding and strengthening our capacity and be able to have different labs across the country being able to test with a PCR test, but also scaling up the testing with the rapid test, whereby we have now private clinics as well as all public health facilities that are able to use this rapid test. Under the risk communication and community engagement, which has been really proven to be a key area in order to have our community as an active actor rather than a beneficiary. And this has made our response really swift, but also having the community understanding what the government is advising, as well as the expectation from them. Under the operational support and logistics pillar, we had an interministerial strategic procurement committee that was mandated to validate and follow up on all urgent procurements. And this made the availability of commodities swift for an effective COVID-19 response. We also built around the continuity of essential health services, which is key, and we used different channels from the classic facility-based. We introduced home-based care model, as well as the use of online services so that people can have access to essential health services. Under the data management, we tried as much as we could to digitalize the systems so that we can really have real-time data to inform the decisions made. Moving to the vaccination campaign, as of last 2 weeks, Rwanda has received around 22 million doses of COVID-19 vaccine. And this came through 3 main channels, the main one being COVAX facility, the second donation from different countries, and various bilateral agreements made by the government of Rwanda in the effort to make sure we are really having access to the vaccine. As of now, 66% of the Rwandan population were vaccinated with at least 1 dose, while 55% have received 2 doses where indicated, and 8% have already received their booster dose. The target for us is to achieve 70% vaccination coverage by June this year, and to include 5 to 11 years children in order to achieve 86% vaccination coverage by December this year. As we strive to build a resilient health system, Rwanda has invested in the following areas, increasing testing capacity, and we are happy. We are now working with the WHO on a specific project around the National Health Laboratory Services, which is going to be a comprehensive but also high-level laboratory facility with BSL-3 and BSL-4 services or facility. We also invested in clinical management with the renovation and the expansion of some infrastructures, including ICUs in hospitals, procuring oxygen plants, but also we recently constructed a mobile hospital that is going to serve as isolation facility that is that can be even used for in the future pandemic if we are unlucky to face others. We also invested in local manufacturing of health commodities such as PPEs, hand sanitizer, and we are now working on establishment of vaccine manufacturing plant in Rwanda, but also which will be not only supplying the Rwanda as a country, but also the African continent and beyond. In conclusion, we also have some lessons we learned we would like to share with you. One, political leadership makes the difference. Whatever you want to implement, if you don't have the backup of the leadership, it is a bit hard to really implement as you plan. Secondly, preparedness is not only what governments do to protect their people, it is also what the people do to protect each other. And that's where we really have the community engagement. Thirdly, the impact of pandemics goes far beyond their immediate health effects. And this is common to all countries where we had devastating effects on social and economic status across countries. Fourth, current measures of preparedness are not predictive. Our understanding of pandemic preparedness has been inadequate and requires coordination and preparedness mechanisms that span across borders, regional and global, to be able to respond to outbreaks early and more effectively. Fifth, the return on investment for global health security is immense, and this is obvious to anyone. On the second point, development assistance is an inadequate model for financing, investing in pandemic preparedness. We all have seen that countries have really to invest from domestic resources in order to be more prepared for the next pandemic. Finally, the global preparedness is not simply the sum of national preparedness. A pandemic, by definition, is a global event, and as such, demands collective global action. With this, I pause here, and we'll be able to provide more clarification during the discussion. I thank you very much.
Thank you, Dr. Tugishime. Let me turn now to Dr. Arlindo Nascimento do Rosario. Dr. Nascimento do Rosario, could you update us on Cabo Verde's key innovations that the country has undertaken to respond to COVID-19 and to reach high vaccination rates? Dr. Arlindo.
Muito...
Olá. Bom dia.
Muito obrigado e bom dia. Queria cumprimentar a Sra. Diretora Regional do MS, APRO, Sua Excelência o Ministro da Saúde da Ruanda, Sr. Diretor-Geral do Departamento Nacional de Saúde da África do Sul, todos os ilustres participantes, os seus jornalistas. Quero, em primeiro lugar, agradecer o convite que me foi endereçado para participar como paneelista neste importante fórum. É uma grande honra para Cabo Verde e para mim, enquanto Ministro da Saúde, participar e poder transmitir a experiência de Cabo Verde no enfrentamento da pandemia pelo SARS-CoV-2, os impactos do ponto de vista sanitário, económico e social têm sido veras devastadores. Minhas senhoras e meus senhores, Cabo Verde notificou o seu primeiro caso da Covid-19 em 19 de março de 2020. Como é um país pequeno, arquipelágico, constituído por 10 ilhas, fomos afetados de uma forma desproporcionada pelo Covid-19. Devido à nossa dependência do turismo e das cadeias de abastecimento globais, a Covid-19 teve um impacto significativo no desenvolvimento económico do país, causando redução das oportunidades de negócios, perda de empregos e queda da produtividade total e, consequentemente, a recessão do PIB e aumento da dívida pública, agravando o cenário macro-fiscal. No início da pandemia, o FMI estimava uma recessão económica equivalente a 6,8% do produto interno bruto de Cabo Verde para 2020. A previsão foi revista para 14% em larga medida pelo impacto da ausência do turismo, num setor que garante 25% do PIB do arquipélago. Embora tenham sido 2 anos difíceis, estou satisfeito por ver Cabo Verde a sair da fase aguda da pandemia. Após uma onda severa de Covid-19 ligada à variante Omicron, entre o final de dezembro de 2021 e o início de janeiro deste ano, os casos diminuíram de 7.182 casos na primeira semana de janeiro para 105 na última semana. E a taxa de testes positivos é atualmente em média de 2,5%. Por mais desafiante que tenha sido a última vaga, ao longo da época de férias, foi notável que os hospitais não ficaram sobrecarregados e os serviços de saúde de rotina continuaram a funcionar. O número de mortes foi muito inferior ao esperado, com uma taxa de letalidade à volta de 0,7%, situando-se abaixo da letalidade provocada por ondas anteriores. Por que é que isto aconteceu? Isto deveu-se, sem dúvida, em grande parte, às elevadas taxas de vacinação contra a Covid-19 em Cabo Verde. Dados recentes indicam que 72,5% da população com 18 anos ou mais já recebeu 2 doses de vacina. Um programa de vacinação baseado nas escolas e dirigido a adolescentes dos 12 aos 17 anos de idade, iniciado em meados de dezembro, alcançou já 74,6% deste grupo etário com uma dose de vacina. As segundas doses estão agora a ser administradas, estando já 51,7% dos adolescentes com vacinação completa. Embora a luta contra a Covid-19 tenha sido difícil em Cabo Verde, reconhecemos vários fatores importantes que contribuíram para o nosso sucesso. Um sistema de saúde com uma base forte, que fornece serviços de saúde primários de alta qualidade e uma população dispersa por 10 ilhas. Isto inclui uma mão de obra de saúde empenhada, capaz e com uma boa capacidade logística. Ao longo das últimas décadas, temos trabalhado arduamente para assegurar que todos os cabo-verdianos estejam a menos de 30 minutos do centro de saúde. O sistema de saúde foi capaz de se mobilizar rapidamente para fornecer vacinação em todas as ilhas do arquipélago. Além disso, quando a Covid-19 começou, demos prioridade à realização de testes e tratamentos para a Covid de forma gratuita. Uma boa confiança entre a população e o seu governo, particularmente no setor da saúde. Isto contribuiu para elevar a taxa de vacinação e elevado cumprimento de medidas sociais e de saúde pública quando foram encorajadas e implementadas pelo governo. A comunicação regular e adequada com o público, informando sobre o curso da epidemia e fornecendo informações precisas e oportunas sobre as vacinas. Isto reforçou a confiança que acabei de referir. Em resumo, Cabo Verde está empenhado em proteger a sua população contra a Covid-19, mesmo quando a doença passar de um contexto epidémico para um contexto endémico. Continuaremos a encorajar medidas adequadas de saúde pública para a proteção individual e proporcionar o acesso universal às vacinas para as populações elegíveis. Acreditamos que Cabo Verde é um exemplo de como um sistema de saúde forte, uma mão de obra empenhada e capaz e elevados níveis de confiança da população nos serviços de saúde podem ajudar a combater uma epidemia e permitir que o país retome o seu forte progresso no desenvolvimento económico e social. Para terminar, devo realçar o excelente trabalho da diplomacia de saúde, que conseguiu mobilizar junto dos nossos principais parceiros da cooperação bilateral e multilateral os recursos necessários nas várias vertentes do combate à pandemia, com destaque para as vacinas. Permitam-me destacar ainda o extraordinário apoio das agências das Nações Unidas e da OMS, através do mecanismo de facilitação COVAX, que permitiu Cabo Verde fazer um bom combate à pandemia. Muito obrigado.
Muito obrigada, Dr. Nascimento do Rosário. Now that we've heard from all our panelists, let me give the floor to the media, to the press, and it's your turn, ladies and gentlemen, to ask questions. To do this, please use the question and answer function of the Zoom application. Please remember that you will need to provide a name and the news organization you represent to have your question asked on the floor. We also have on hand Dr. Richard Mihigo, coordinator of the Immunization and Vaccine Development Program, Dr. Tierno Balde, Regional COVID-19 Incident Manager, and Dr. Nixi Gumede Muletsi, Regional Virologist. Now, let's give the floor to the journalist. And the first question is from Xinhua Naftali. And the question goes to Dr. Moeti. Do you think, Dr. Moeti, that the pandemic is ending in Africa? And what are your future projections?
Thank you very much. No, we can't say, well, the pandemic is moving into a different phase. So we've had several waves. We've had very intense transmission with very severe consequences as each wave has peaked. And then we have had a reduction in cases. So we think that we're moving now into, especially with the vaccination expected to increase, into what might become a kind of endemic living with the virus. The virus will be here. We expect that with the levels of vaccination and continuing boosting with vaccine availability, we will minimize the level of the peaks. Of course, we have to expect that there may be variants and understand what could be the characteristics of those variants as far as transmission is concerned and as far as lethality, that meaning causing death, is concerned. I believe that we are transitioning from the pandemic phase and we will now need to manage the presence of this virus in the long term with the measures that have already been mentioned by all the speakers.
Thank you, Dr. Moeti. May I ask the same question to Dr. Alindu? What do you think? Do you think that we are ending with this epidemic? And what are your future projections, Dr. Alindu?
Muito obrigado pela questão. Penso que a doutora Moeti respondeu muito bem a questão. De facto, existem incertezas, muitas delas derivadas ainda de baixa taxa de vacinação a nível, sobretudo nos países africanos e não só, e isso também proporciona para que haja progressão do vírus e agora outras variantes, o aparecimento de novas variantes. Eu creio que a estratégia será de reforço da vacinação a nível mundial, de forma a que consigamos ter alguma imunidade e diminuir o aparecimento de novas variantes. Portanto, ainda existem muitas incertezas e todas as medidas que têm sido recomendadas devem prosseguir. As medidas de higienização, de distanciamento, de máscaras e a vacinação, sobretudo a vacinação.
Muito obrigada, Dr. Arlindo. This is a question for Dr. Mihigo from James Macharia Chege at Reuters in Johannesburg. Dr. Mihigo, is the WHO Africa worried that countries are sitting on large vaccine stocks, which either could expire or could be better used in other parts of the continent? How can we address this, Dr. Mihigo?
Okay, thank you very much, Elizabeth. Indeed, we are all expecting that the vaccine cannot sit idle in the countries. And then as soon as they reach the country, they need to go into the arms of the people. WHO actually is doing everything. We are now supporting all the countries to make sure that they've got enough capacity to deploy this vaccine as soon as possible. we have set up quite robust monitoring system to actually provide early warning signs for such situation, and then to be able, and that was done in the past, sometimes to redeploy vaccine from one country to another to make sure that the vaccines are not expiring. But the good signs is that the last couple of weeks, we have seen most of the countries actually accelerating the uptake of the vaccine and then putting in place robust mechanisms to deliver these vaccines as the supply is slowly increasing. So this is something that I know all the countries are working quite hard to avoid. And with the support of the WHO and other partners, I think we are trying as much as we can to minimize any waste of vaccine.
Thank you very much, Dr. Mihigo. This is a question for Dr. Balde. Based on the current levels of immunity and vaccination, are you expecting that many more COVID waves will appear this year, or will we reach a kind of endemic situation already in 2022, where the virus is constantly circulating, but at lower levels? Your opinion on that, Dr. Balde?
Yeah, thank you, Elizabeth, and thanks for the question. I think we have really learned a lot over the past 2 years, and it's as the panelists have said, it's really difficult, to predict with a certain level of certainty. What we are seeing currently, it's quite a huge circulation of the virus, especially with the Omicron in most of the countries in Africa here, at different level, definitely, and also a certain level of capacity. So I think in addition to what have been said already, what I would like to add here, there've been really some kind of elements which can tell us at least, that there is a certain level of capacity to handle any type of new waves which can happen. And it's difficult to definitely to predict, the occurrence of those waves. But at the moment, a lot of actions are ongoing. We have heard, some examples from Cape Verde, Rwanda, and there is definitely a certain level of variability amongst different also countries. But we are quite confident that based on what we have seen over the past 2 years, there was some kind of prediction of a really, a high number of cases, high number of deaths. But we have seen that Africa, African countries stands, and we might just need to continue, increasing the capacities of being ready, to address any new type of wave which can happen, in the next months. Thank you.
Thank you very much, Dr. Balde. We have Naomi O'Leary from the Irish Times who wants to go live. Naomi, are you on the call?
Yes, hello, can you hear me?
Yes, please. Naomi, who is this question put to? Who are you asking this question to?
I would be interested in a response from any of the panelists. So I have 2 questions actually. One is, what do you think endemic COVID-19 will look like? How disruptive is this going to be, or how different to the kind of normal that we knew before the pandemic will endemic COVID be, do you think? And a second question that I have is there a challenge in some countries in Africa about data underrepresenting the number of COVID-19 cases and deaths, so giving a false impression that the continent is comparatively less affected than other regions of the world? Thank you.
Okay, so let me give the floor first to maybe Dr. Arlindo and then Dr. Moeti to answer the question.
Muito bem. Sentindo bem a primeira questão, qual é o comportamento da endemia, eu diria que os países vão ter que, de facto, se adaptar a um novo normal. O vírus veio para ficar, de certa forma, endémica. Mas a vida tem que continuar. A atividade económica tem que aparecer. Necessariamente, temos que, de facto, reforçar a imunidade da população, através das vacinas, mas também diria que reforçar todo o regulamento sanitário internacional e permitindo, de facto, alinhar as medidas nas fronteiras entre os vários países. Eu creio que nós temos que encontrar formas, cada país irá encontrar formas adaptativas para a nova fase que poderá surgir. Bom, quanto à subnotificação, penso que não me cabe a mim responder a isto, provavelmente o Dr. Moetti poderá ter mais dados, mas eu creio que a informação oportuna à população e às organizações internacionais permitirá, sem dúvida, primeiro, conhecer de facto a evolução da pandemia em cada país, mas, sobretudo, garantir o peso da pandemia. Isto é, sobre o sistema sanitário, o lado económico e social, portanto, os impactos que a pandemia provoca. Portanto, há todo o interesse, do meu ponto de vista, há todo o interesse em que os dados sejam revelados de forma transparente e oportuna.
Muito obrigada. Dr. Moetti, would you like to answer on those two questions? And maybe South Africa can come in for the endemic part of the question.
Okay, I wasn't hearing you well. Okay, thank you. Yes, I think it is the question of the day, and we've sometimes heard statements like, well, it'll be like flu. There are some who think it will not be like flu because, well, of course, in one way, the flu variants are also emerging almost every year. The vaccines are having to be adapted and changed every year. So we've learned that lesson, and there are plans to keep adapting or to make vaccines that can be adapted to different variants. So that's one thing. The lessons that we've learned from both example of the flu and the pandemic so far, I think are making us very alert about what needs to be done at different levels, what needs to be done at the community level, what needs to be done within countries, what needs to be done internationally. I agree very much with the Minister of Health, Minister Alindo, and then what needs to be done at the global level in terms of how to learn and put in place the platforms, the measures that will perform better. So it'll be a matter very much, in my view, of adjusting the tools, developing new tools, but around several basic principles. One, we need a tool like a vaccine that will protect from, hopefully, transmission, if not protect from severe illness, which is the kind of tool that we have at the moment. We need to be able to use data to locally put in place those measures that will prevent transmission. So I think as people, we will need to learn to get used to having to go back to wearing your masks, reducing gatherings, reducing those events that gather people as these waves go up. And then as they go down, restoring normal life again so that we can have economic life, education, when we haven't talked about the multifaceted impacts of some of the measures that had to be put in place. We will need to live with this virus. We can predict to some extent. For example, we know that we have relatively low, but not as, but anticipated to improve in the next few months, coverage rates. We have the winter season coming in Southern African countries very soon, where we had a peak wave. So we should anticipate that and be able to see if these were the factors, what can we do next? People have to stay indoors. This is what's happening in the Northern Hemisphere now. They're having a wave because it's winter. People can't be outside. But we will have become accustomed to doing certain things. I think one of the other things that we have learned in Africa is that it's not just public health measures that are important. Socioeconomic support measures are needed by the population so that they impact on other aspects and blunt the impact. On the question of underreporting, yes, we're very much aware that our surveillance systems, the problems that we had on the continent with access to testing supplies, for example, have led to an underestimation of the cases, as has been the case, we think, in other regions as well. So we have estimated that the number of reported cases or infections are underestimated about 7-fold, and deaths 2 to 3-fold. So we are aware that the situation is not as it looks, but there is a lot of effort being done to strengthen the surveillance to make sure that we use the data for the most important intention now, meaning we follow where the virus is peaking, and we are able to inform improvements that have to be made, for example, in the capacity to care for cases to stop people from dying. At the same time, we will have then these longer-term intentions to improve the systems, to invest more in resilient health systems. That's another lesson that has been learned. It's not the time to start pouring in money when you are going through a pandemic. So the lesson of Cabo Verde has been a very good one. It just reinforces the advocacy for investment in health in so-called peacetime, before we have the wave or the other pandemics. Thank you.
Thank you. Thank you very much. So let me turn to Dr. Buthelezi. Dr. Buthelezi, what about this being endemic? How would be the endemic COVID-19? How would we be like if we live in a endemic COVID-19? According to you.
Thank you very much. I think my sister, Dr. Moeti, has covered this very well. But for us, for example, what's more important is that legislatively in South Africa during the COVID-19 outbreak, we had to actually resort to one of the most powerful laws that we have, which is called the Disaster Management Act. Why did we do that in the first place? It's because our own National Health Act did not have the necessary tools to deal with this epidemic. But what we've done then subsequently to that was that we then needed to adjust our own health regulations to see that in future, how do we actually live with COVID-19? I mean, the issues that have been mentioned in terms of public health measures, what are the powers? South Africa is quite a very litigious country. I think since COVID-19, we've been to court more than 20 times, being challenged on the number of regulations. Lawyers are actually laughing to the bank. So basically, we've adjusted our laws so that it becomes normal on how we deal not only with COVID-19 in an endemic phase, but with any other public health threats in the future, using the lessons that we've learned from this. So secondly, the normal usual surveillance, or maybe just to finish on the legislation, we also hope that with the window that we have through the leadership of the WHO, re-looking at the international health regulations also, so that we are able to deal with issues in the future. Now, secondly, is that we need to continue our surveillance like we do for most of the diseases. As Dr. Moeti has mentioned, like we do with flu, it's actually changing every year, so we need to adjust. But more importantly, with the strong genomic sequencing that we have in the country, collaboration with different institutions, also including colleagues from the SADC countries, with the heart being here in South Africa, we will be able to monitor and see if there are any new variants that are coming and how do we adjust. But basically, from the past 4 waves that we've had, we have enough tools that we will be adjusting on a day-to-day basis to be able to deal with the epidemic, but not in the way that we dealt with as it came unannounced to all of us. But more importantly is the health system in itself, integration of everything, not verticalizing into the usual health system, the vaccination as part of the usual EPI program that we do for the children, we're integrating it into that, the actual budgeting on how we do that, and also the testing, like you do your testing for your other communicable diseases like HIV and TB, is the same issues that will help us when we manage COVID-19 as endemic. Thank you very much. I'll stop there.
Thank you very much, Dr. Buthelezi. We have a question from BBC and I will ask this question to Dr. Mihigo. Dr. Mihigo, is it possible to know the number of unused vaccine doses that countries in Africa have been obliged to dispose of because of the prevailing vaccine hesitancy in Africa? There's another follow-up question, but maybe I can ask this question later on.
Yeah, no, thank you very much, Lisa, for this question. I think we are working with countries really to try to follow up quite closely the data related to vaccine usage in the country. And I think it's important to put things into perspective. When we are looking at the data that we have been able to collect so far, out of the 675 million doses that have been received in Africa so far, our estimation is showing that around 3 to 3.5 million doses have been discharged. This represents 0.5% of all the vaccines that have been received. So I think this is not really, of course, any vaccine that is waste, it's a big issue. But if we looked at the bigger picture, the continent has not done that bad, 0.5%. And we cannot necessarily attribute that to only vaccine hesitancy, because we know very well that in some instances, countries were obliged to discharge some of these vaccines because they received those vaccines very late with a very short shelf life. So we cannot really condemn country in general. But if we looked at what is going on in other regions as well, the vaccine discharge is not a phenomenon that we are seeing in Africa alone. I think even in developed countries, we have seen vaccine that has been destroyed. But to avoid this situation, and I think this is what is more important, I think a country now and the COVAX facility in general has taken the option of supplying vaccines to the country based on country demands themselves, and not adopting a mode of full aspects, responding to the country demand rather than pushing the vaccine, sometime which have got short expiry dates to the countries. So I think the prospects in the future are looking quite very good, because countries are requesting vaccine that they can use, but also WHO, UNICEF, Gavi, Africa CDC have also put out a strong statement for vaccines, for countries to receive only vaccine that have got at least a quite extended shelf life, so that country can be able to plan and deliver those vaccines on time. Over.
Thank you very much, Dr. Mihigo. I told you I had a second follow-up question. Is WHO against vaccine mandates in Africa?
Well, I think the issue of vaccine mandates depend on, of course, the national country regulation. But I think what WHO so far has been doing was to advocate really a equal distribution of the vaccine to everybody, to make sure that all the population can get access to these life-saving tools, so that they can strive in their day-to-day lives. And it becomes quite easier when you have a big proportion of the population that have received the vaccine to impose some of these legislation without necessarily putting a large proportion of the population out of reach for public services or of others. So I think for the moment, the really accent has been pushed on to increase this equitable distribution of the vaccine, so that as many people as possible can get protected. And now it will depend on country by country legislation on how they want to take this forward. But we really are advocating mainly for a equal distribution of the vaccine to everybody.
Thank you very much, Dr. Mihigo. A question to Dr. Albert Tuyishime from the Minister of Health of Rwanda. Dr. Tuyishime, what plans do the Ministry of Health in Rwanda have to ensure that COVID-19 cases do not increase?
Thank you very much for the question. I think we are now well equipped more than ever in terms of knowing what works for the prevention and what people should be doing And on top of that, we are lucky we have now this new tool, which is the vaccine. So I think what we can do, what we are doing at country level, we are keeping our surveillance at the same level as when we were at the peak of the previous waves. We are keeping our capability in terms of testing at the highest level, but also we are encouraging our population, our people, to get vaccinated. So with these different tools, we believe keeping the level of alertness and implement what we know very well it's working, we believe this is going to help us really keeping low the number of new cases. But as previous speakers said, it's this pandemic is a bit unpredictable. So we have to keep on watching, keeping our surveillance on the highest level so that we can identify a peak of cases and then implement impactful interventions. Thank you.
Thank you very much. Do we have Paul from Lancet live on the call?
Yes, I'm here.
Thank you, Paul. You may take the floor.
Thank you very much. So I also like to start with Dr. Herbert. In January, and I think several times last year, you mentioned the need for mass testing. You also more recently, you mentioned plans to roll out testing in schools in Rwanda. So I'd like to know what is the latest regarding mass testing for COVID in Rwanda. And for other health ministers, I'd like to know your plans towards actually maximizing the level of awareness and strategies that your countries have been able to roll out for COVID, in also controlling other diseases that have been in Africa for long, in expanding their testing and also vaccine rollout. For instance, we have several vaccines that the uptakes are really still low in Africa. Are there plans going into the endemic state to really maximize these awareness and structures that you've been able to put in place for COVID? Thank you very much.
Thank you very much, Paul. Apologies, ladies and gentlemen, we're going to run a little bit longer since we received many questions. So I think you have a question, Rwanda, and then maybe Cabo Verde can also add on. Thank you.
Yeah, thank you very much, Paul, for the question. When we talk about mass testing here in Rwanda, it's part of our surveillance, and this is really done regularly. We are doing this twice a month, every 2 weeks, whereby we test at different levels at community from different institutions. We also have drive-through testing sites in the city of Kigali, which has been really the epicenter of the pandemic since the beginning. And we are doing this just to have a picture of the pandemic in the country, so that if we really needed to adapt or adjust the interventions, we base on the picture from that mass testing. So, as you said, we are doing this regularly to inform, as part of our surveillance, to inform the interventions we are implementing. And this is done, is being updated or adjusted depending on the situation. So if we have schools, kids going at school, then we include schools in the mass testing. But if we have them at home during the holidays, then we can use the community picture. So it's a dynamic effort or initiative, which is really intending to make sure we are basing our interventions or our advice to our population based on what we are having at community level but also the numbers we are getting from the mass testing. Thank you.
Thank you. Dr. Alindo?
Muito obrigado. Bom, penso que nós devemos continuar, aqui em Cabo Verde, estamos a fazer isso, continuar com o processo de vacinação, aumentar mais a taxa que já temos neste momento, mas inclusive já estamos a entrar com a terceira dose do reforço da vacinação. Cerca de 15% da população adulta já recebeu também a terceira dose. Vamos prosseguir com a campanha de vacinação. Nós também temos alguma, embora não muito alta, mas muito significativa, mas temos alguns conselhos onde há alguma resistência. Mas aqui a estratégia passa pela comunicação, uma comunicação que deve ser o envolvimento das organizações não governamentais, das ONGs que trabalham nessa área, mas também da própria comunidade, aproveitando todas as forças da comunidade para ajudar-nos a passar a mensagem da importância e dos resultados da vacinação. Portanto, é neste caminho que nós continuaremos a trabalhar. Quanto à segunda questão, no que diz respeito a outras doenças, felizmente, desde o início da pandemia, fizemos uma reorganização da prestação de serviços nas várias estruturas, por forma que os doentes crónicos, portanto, com doença crónica não transmissível, pudessem continuar a ser o seu seguimento. O programa alargado de vacinação, mantendo os índices que nós temos, acima de 95% de cobertura, mesmo também todos os programas de saúde reprodutiva. Nós damos muita importância à questão da segurança sanitária, de forma geral. Um país, Cabo Verde, como um país que depende muito também do turismo, a segurança sanitária é uma garantia também para o turismo. Nesse sentido, nós estamos a trabalhar também em termos das lutas, fazendo luta antifactorial. Já estamos no 4º ano que não temos nenhum caso de transmissão autóctone de paludismo em Cabo Verde, mas também outras doenças virais, nomeadamente a transmissão vertical do VIH. Enfim, todos os programas continuaram a ser desenvolvidos por forma a encontrar um equilíbrio em todo o sistema de saúde. É fundamental termos isso. Nós sabemos que a Covid agrava, também tem impacto sobre as pessoas com doenças crónicas não transmissíveis, cardiovasculares, hipertensivas, etc. Portanto, esse trabalho tem sido feito de uma forma integrada, permitindo que também essa corrida seja feita.
Obrigada, Dr. Alindo. Let me turn to Dr. Buthelezi. Dr. Buthelezi, I have a question from Moga Kamal from accesstohealthcare.net. And here's the question. What are the vaccine delivery challenges facing African countries almost a year after first doses arrived in some of the countries in the continent?
Thank you very much. I think firstly, as we all mentioned earlier, including the WHO RD, initially the rich countries were holding the vaccines and vaccine apartheid, which of course through the relevant political bodies, we managed to break into that. I think the second issue that we faced was the different regulatory stringent approval processes and that we have as countries have to use to protect our citizens, which of course in South Africa we did try, and I know there is actually a link between the regulatory authorities in different countries and our own in dealing with the matters. The third one is the fiscus in itself. I mean, the vaccines are not very cheap, and one had to negotiate, and also the stringent conditions that were put by the manufacturing companies. I mean, including the issue of forcing the countries to to actually establish the Northward Compensation Scheme, signing the disclosure clauses. I mean, we had to go through to our cabinet to be allowed to sign those contracts because some of them actually were actually affecting the actual financial independence of the financial sovereignty of different countries in terms of those big ones. Actually, I can tell you even one of the big things we had to fight, one of the vaccine companies wanted the ministers to sign contracts. I mean, ministers don't sign contracts. Contracts are signed by directors general as accounting officers, but they didn't want to accept that, such that we had to get an intervention. Then obviously coming to the actual delivery processes is the issue of the systems to store and distribute the vaccines in terms of the cold chain that is necessary for that. I mean, different countries have got different capacities. I mean, we all know that some of the vaccines actually needed up to -70 degrees in terms of cold chain management, and very few countries, actually in South Africa, we only had one or two research institutions that had that capacity to do that, which was also a limitation in itself. But fortunately, we did see a relaxation of that as we were moving forward. But also the whole geography and of the different countries in terms of reaching the poorest of the poorest in the rural areas is also a limitation, which of course we've tried to mitigate. So there's quite a number of them. But currently, I must say, really, where we sit as a country is that all those I think we've been able to deal with. Now the matchup, hence we don't have a supply problem. We currently now have an uptake problem, which is what we are now facing. Hence, we want to relaunch our program, rebrand our program within the next 2 weeks to try and see how do we get people to vaccinate. When we started, we were able to do close to more than 200,000 vaccinations per day. Let me tell you, we're now struggling to reach 70,000 vaccinations per day. This is inclusive of the second doses, booster doses, the adolescent doses, and we're just struggling. We've been trying, and hence the whole issue of the danger of the vaccines expiring in the shelves. So I think that's what we should be confronting now. How do we actually ensure that we are able to get the uptake of the vaccine? Thank you very much.
Thank you very much, Dr. Buthelezi, for this very comprehensive reply. We are coming to an end of this virtual press conference. Let's turn to our panelists for a final message. You've got 1 minute each, and I will start with Dr. Alberts, and then Dr. Alindu, Dr. Buthelezi, and finally Dr. Moeti.
Yeah, thank you very much. Just to thank Dr. Moeti and the WHO team to organize this briefing, which is really a lessons learned exchanging session kind of, but also work on the community engagement as well, because when we meet journalists, it's a way of educating our people, but also communicating the new development on this pandemic. So it's a really commendable initiative. Secondly, we all know the pandemic, the virus is still around. So we have to keep on our preventive measures, and then look at the science and share whatever information or new development we can have at country level so that others can learn from that. So with this, I thank you very much.
Thank you very much. Dr. Arlindo Rosario.
Bom, muito obrigado. Para terminar mesmo, quero de novo agradecer ao OMS, a minha irmã, a doutora Moeti, primeiro, e felicitar pela liderança dos processos a nível do continente. A OMS Afro tem dado exemplos de grande organização e de forte liderança, e quero, de novo, também estender essas felicitações para o escritório local do OMS aqui em Cabo Verde, que tem estado sempre a acompanhar, desde o início da pandemia, dando todo o apoio, a assistência técnica para lidarmos com esse processo. De igual modo, agradecer também, ou reconhecer, todo o trabalho que tem sido feito e dos vários parceiros da nossa cooperação. A pandemia não terminou, temos ainda desafios importantes a enfrentar, mas quero deixar também uma palavra de apoio e de solidariedade para os países do nosso continente africano que lidam com situações como aqui foram relatadas, de dificuldade de acesso à vacina, esperando que a taxa de vacinação possa aumentar, porque é uma pandemia, nenhum país, o mais rico ou mais pobre, consegue por si só resolver. A solução para a pandemia está no envolvimento global de todos e numa ação de solidariedade e de responsabilidade. Portanto, são essas as mensagens, as palavras finais. E uma vez mais, obrigado por convite para participar.
Muito obrigada, Dr. Rosario. Let me turn to Dr. Buthelezi for a final.
Thank you very much. Thank you very much. Thank you to Dr. Moeti for the leadership and for inviting us. My part in short will be, as Africa, I think we will emerge here much stronger. Of course, COVID has actually accelerated some very difficult discussions that we've been grappling with over years. One more important one is for local production for Africa, which we're very happy that this has accelerated that. I think the second one, of course, is the issue, the acceleration of the discussions of the patents, the TRIPS agreement, that the WTO, I mean, there's been a lot of calls that we need to deal with the issues of patents. Which is one issue that is an Achilles heel for most of the African countries, with the whole issue of patents and all the APIs. Actually, there's none of the APIs that are here in Africa. So those are the issues, the discussions that are now being accelerated, and we think will actually emerge this stronger as a continent and be able to deal with our own problems using our own resources. And we already have our strong scientific background from our scientists. Thank you very much.
Thank you very much, Dr. Buthelezi. And finally, Dr. Moeti.
Yes, thank you very much. First, I'd like to again thank my fellow panelists. Thank you for having accepted to join us. Muito obrigado, particularly to my brother, Dr. Alindo, for having joined us, but to my colleagues as well, the DG and the director from South Africa and Rwanda. And thank you to the journalists for having joined us. Of course, we value your communicating with the communities and letting people know what's happening. So just to conclude, indeed, we've learned a lot in 2 years. There have been a lot of difficulties. So some of the lessons have been particularly painful. I would say that the third wave was a very painful one as far as our health systems were concerned, the number of deaths and the many adjustments we had to do in a painful hurry. But I also see a very interesting, challenging moment now. Clearly, we're going to work very hard at all levels on the vaccine in our countries. So this is what we have to do. And then as we are doing that, we'll enter into this phase of living with this virus, adjusting at several levels so that we deal with COVID-19 and with the next virus threat that will threaten us. So I'll start first of all at the community level. We've seen people respond, and I'd like to thank African communities for what they have to do, the sacrifices that they made, and what we continue to need them to do. And I'd like to leave them with one message: please go and get vaccinated. Second message, please do not spread stories about vaccination that discourage and frighten others. And if you've been vaccinated, please tell your neighbors, your family, you're vaccinated, you're fine, and encourage everybody to get vaccinated. Because it's at this level, I'd like to agree very much with Dr. Tuyishime, the importance of communities, families, action at the personal level that will really make a difference. Then secondly, at the continental level, I also think we've had political leadership emerge very strongly, and it'll never be the same again because we've seen it translated into action. And I'm very confident that some of the structures that are being put in place, the Africa CDC, the African Medicines Agency, are only going to make us better prepared and even act better, stronger on the pandemic now. And then finally, at the global level, there are many discussions that are going on about how to improve the global mutual support, solidarity, mutual responsibility of countries, including through the international health regulations, where we're going to have clearer rules, I hope, within the next year about how countries must be responsible for sharing data and informing their neighbors of a risk. And we think in Africa, of course, we need some of this to translate into global solidarity about sharing the tools that are needed at a moment when many countries are at risk and are affected by the pandemic. I'm hoping very much that going forward, all of this will be put into practical action so that some of the painful times we've seen in the past are changed. So thank you all very much for having joined us, and let's spread the word to our communities.
Thank you very much, Dr. Moeti. This is the end of our virtual press conference. You heard Dr. Moeti. Get vaccinated and keep safe. Thank you very much. Bye-bye.